Hey everybody, it's William McComb, social worker and chemical dependency counselor, and I'm here with
John Corey, LCDC3 and student nurse, and today we are joined by Dr. Thomas McCartney, addiction specialist.
Hey guys, I'm excited to be here.
Good.
Awesome. Thank you for joining.
Yeah.
So to get it started off, COVID-19, that is the big topic, and we really wanted to, just collaborate on this whole thing and what your thoughts are on it.
Yeah, it's obviously the top of everyone's mind right now, which I think is a good thing, right? This is a pandemic that has, kind of captured everyone's mind. And so it's important that's in our forefront. But another thing to remember especially when all this is going on, is that we still have our daily medical problems, right? We still have other things going on. Whether that's, you have, people are still needing to go to the doctor for broken bones, and they're also still needing to go to the doctor to treat their addiction. So, it's important that we don't just focus on this one medical problem that's happening, that, we need to care about our bodies in general still.
100%. What do you think is an important balance between taking the precautions for this virus while balancing the needs of obviously daily life?
Yeah, I think part of the problem is, and I think medical care in general is, I think you kind of have one subset of people that goes to the doctor for anything, right? Like, oh, I have a cough, I need to go to the doctor. Or, oh, I scratched myself, I need to go to the doctor. And then you have another subset of people that they're having massive chest pain, can't breathe. Oh, I'm not going to go to the doctor, I'm fine. And so I think we need to kind of find that happy medium. And I think with this going on, that's kind of helping people find that, because I think some people normally would have said, oh, I probably have a common cold, but I'm going to go to the doctor to get some cough medicine, right? And I think now they're saying, probably not worth the risk. And I would agree with that in that situation, that, if you kind of have like this mild like cold symptoms, probably not worth the risk. But people still, if you're having chest pain, you obviously should go. So I think it's perhaps maybe having people refocus on what requires them to go to the doctor. But I mean, if you're having legit issues, if you're having symptoms that you're concerned about, fever, cough, or you're having other pains like chest pain, you have a broken arm, like you're concerned about that. You're concerned that, you cut yourself and it needs stitches, you should still go to the doctor. Like that's not a reason not to go. When you go to a facility, they're going to have precautions in place. They're going to have, ways for you to wash your hands, ways for you to cover your face. The places are still safe to go.
How about from an addiction medicine standpoint? Yeah. What are reasons to either go or contact your doctor or counselor? Yeah. Do you think during this time period should that change or be modified?
Well, so obviously we still need to have our check-ins with our patients. Addiction's an active process. People are you're always fighting it daily. So I think we still need to see them. We still need to have our interaction with them. But the problem is you have the added step of, obviously there's all this stress of the virus. Like the virus is really, making people stressful. And that not only from the presence of the virus, but the anxiety around, like, am I going to get it? Are my family members going to get it? What happens if I get it? So if you have, other medical or other, psychological concerns around it, it's only going to make it worse right now, right?
Yeah, I've noticed that, right? That people were in crisis before.
Yeah.
That this situation is making it. Yeah. It's exacerbating the crisis.
And I'm not an anxious person. Like I'm not someone that has been oh, at that moment in my life I was suffering from anxiety. But in the beginning I was. Like even people who don't right. I was losing sleep over it in the beginning because, a lot of the scariness around something like this is the unknown of it, right? Like when it all started, we didn't, were we going to be able to control it? We talked about social distancing and we think it's going to work, right. But you get so worked up, what if it doesn't? What if it doesn't? Right. And, luckily now that we've gotten more into it, we've seen, stuff like this is working. But, you're going to even have people that don't have these issues bringing them out.
That's true. And where there wasn't a lot of information,
right.
Our minds were free to make monsters,
right.
Out of that.
Yeah.
And I think the more information we've got, the more
right.
experience we have with it, the more we're able to, assess the true risks, involved.
Well, I think one thing that's been cool is I've seen some people post this online that says it's not like I'm not stuck at home, I'm safe at home, right? And so if you change your viewpoint of we're like victims to this virus, where like we're all like the virus is making us do these things. And if you change it to I'm doing these things to stop it, that I think is a help. Like you're in power now, right? Like I'm staying at home so that other people don't get sick and so that I don't get sick, not because I'm afraid of getting sick.
Yeah.
And I think that's the key viewpoint about it.
I think you're right. You know, it's a much healthier perspective,
Right, yeah.
right? To frame it in that way. You know, I've been trying to do that too, thinking, all right, I'm trying to keep other people from getting sick.
Yeah.
You know, I'm not trying to
Right.
able other people.
Right.
You know, I'm trying to protect other people, and even if it's
Yeah.
the same thing, it's a better, more positive
Right.
way to view it.
I mean, if you like view it something similar to heart disease, right? Like we tell people not to eat fast food all the time because it could give you heart disease, and you don't sit there and like feel like you're a victim because you don't get to eat fast food, right?
Right.
So like you're doing something to help yourself, and that's what we're doing in this situation.
Yeah, great point, man.
Yeah, 100%. Yeah, I really like how you took the reframing.
Yeah, it's helpful. I mean, especially because like it's so easy to be like so sad about all this, right? Like, but I mean, really, the fact that we can't go, eat at a restaurant, is that really like altering our lives that much? Not really.
Right.
But it can vastly alter someone who's not going to get sick now.
Yeah.
And I mean, like that's a big difference, right?
Yeah, and that perspective of we're all in this together through this
Yeah.
common enemy. I really
Right.
like that because I feel like a lot of people that wouldn't have reached out to one another are now kind of forced to, but at the same time, we all have a common enemy.
Yeah, exactly. I mean, and I think I feel like, maybe it's just me being wishful thinking, right? But I think a lot of positives can come out of it, right? Like, people are not like as focused on themselves now. We're more concerned about how this is affecting our entire community, which I think if you would have 2 months ago, I don't think any of us would have said the vast majority of, let's use our state. I don't think the vast majority would have said Ohioans care about Ohioans, right? We would have been said people are more concerned about their daily life.
Sure.
And I think this is, I mean, if you look at like how like the peak in Ohio was supposed to be and how it's looking now, I mean, that's a like one group of people working together for the whole group, and it's impressive.
It is impressive.
Yeah.
So there's these theories about was this a good idea
Yeah.
to shelter in place? Because there's the idea that we're just prolonging it
Yeah.
as opposed to what are your thoughts on that?
So the key is like, yeah, and I think people do need to understand that like I think people when they look at the graph, they say, look, if you let it spike, it goes away, right? But the problem is that when it spikes, you've pushed past what our healthcare system is capable of handling. And so if you look at the like projections now, we're actually expected if we keep doing what we're doing and keep doing the social distancing, we're not expected to have a deficiency in beds or in ventilators. And that's huge. So if you can keep the infection low level, but for longer, it means that more people are going to get the help they need. Because if you let it spike, then you're looking at situations where who gets resources and who doesn't. And that's not a decision any doctor ever wants to make. So I think, it's definitely, we would have seen death rates much higher if we let it peak. And so, yeah, it's going to be around a little while longer, but than it would have. I mean, months longer, but we're saving more people. And that's I think, without a doubt, worth it.
100%. Just to bring some numbers into this, so currently coronavirus cases is at 1.6 million, just north of that. We have deaths across the world, 97,000, and recovered 366,000 recovered. So where do you see, moving forward in time, where do we see this virus peaking and actually finally being curved?
Well, part of the problem too, right, in those numbers is that's people that have been tested, right?
Sure.
And so like you have, and I'm not saying this from a standpoint of like fear, but and the cases are much, much higher than this. I mean, because we know that, there's estimates that at a minimum 50% of people are asymptomatic. So meaning people have had the virus and didn't even know they had it. And that's why social distancing is key. Because, obviously if you have a fever and you have a cough and you're having a hard time breathing, you'd say, oh, I probably have it, shouldn't go out to the store.
Sure.
But then there are some people who never had any symptoms who are, if we didn't have the shelter in place, would still be going to bars, would still be going to restaurants.
Right.
And that's where like it really gets concerning. So like the numbers are obviously higher than what we're seeing.
So the idea would be that we're just seeing the tip of the iceberg,
right? Absolutely.
and that the majority, or at least a significant number of the cases, are actually not being detected.
And even then, people that have symptoms, like for instance, like you're a young, healthy guy. If you had a fever and cough, and let's take out the fact that you're in healthcare. Like let's say you're not seeing patients. Let's say you worked at a bank, so you're at home, and if you had a fever, cough, but we're pretty stable, like you were breathing fine on room air, you wouldn't get tested because you wouldn't meet criteria for testing. So you have a subset of people who are asymptomatic that aren't getting tested, and then you have people who are symptomatic but are low risk, so they're not being tested either. And the reason for that is a couple things. It's you hear people talk about PPE all the time, personal protective equipment. Every time someone gets tested, so like you would go to a testing center and get tested, you've used a set of PPE. And so we already have a shortage of that equipment. And so now you're using that equipment to test someone who has a very, very high chance of not being that sick from it. So you haven't used it because of that. And then the testing supplies to actually run the test on the virus are also, in shortage. So like there's several reasons why not to test someone in that situation. And everyone says we need to test everyone, which we do, but we need to get the resources available like before we test everyone.
So it sounds like, at least in some form or fashion, we're going to be dealing with this, modifying our behavior for some time to come.
I think until we have a vaccine. Yeah, I think we're going to be modifying our behavior until that happens.
And so from healthcare delivery, people who work in this field, we're going to have to be resourceful and be modifying for a while. I'm personally concerned about the long-term impact of isolation and what that's going to have. Yeah. Well, what do you think? What are your thoughts on
So I don't think we'll be as isolated as we are now for a long, long time. Do I think it could go on for a couple more months? Probably. But I think eventually we're going to start, saying, all right, we can do this now, and we can do, we can make it so that, you can go get your haircut now, or you can go, and things like that. And I think that'll help because people have the ability to interact more. Once more quote unquote, non-essential jobs open back up, that's where a lot of people's social contact is, right? Like is at work. And so once you open that back up, I think it'll help. And if it does go long term where we're, having to stay at home more, I think it just opens up different ways of connecting, right? Yeah. You need to think, all right, I can't see them, so how can I contact them? And the important part, I think, is, just as much as you're thinking about, reaching out, if you're thinking about reaching out to them, reach out. There's a reason you thought about reaching out to that person, right? Yeah. Either that person's going to help you mentally, like I need to speak to my brother because he's been my person that I connect with and he's the one that helps me, or they may need that connection back, right? So
and it's even more true for those protective class, our senior citizens, or people who have those underlying conditions, to be checking on them.
Yeah, like I said, I usually talk to my parents once a week. Now I talk to them every other day because I'm like I want that connection with them to hear that they're fine, right? And the problem is we communicate so much via text now, right? But that's so impersonal. Like, I could be laying in bed with a fever of 104 and not being able to breathe and be like, I'm fine.
I hate it.
Yeah. But there's no line when you're talking to someone. I mean, I hear you cough every 5 seconds. You're obviously not fine. And so I think it's important to make those why it can't be physical. You still. We have abilities to video talk on our phones now, and you can see them and you can make sure they're okay.
And there really is a benefit to that, and even now doing some of the service delivery over the phone, talking to clients over the phone or via email. It used to be in the group setting or individual setting, I could tell almost immediately just from seeing the person how they were feeling, and get a sense of how they were going to be. And a lot of that's taken out with telephone and so trying to adapt to that, I think is going to be a challenge for people in this profession as we go through this.
That's why I think video as much as possible because it's a little harder to hide in video, but sometimes not all of our patients have access to that type of technology. But I think once people get more used to it, both, healthcare workers and patients. I think both sides will learn that, the patient, maybe I need to open up a little bit more. I need to make how I'm feeling known.
Yeah.
Because I do think it'll change how healthcare is delivered.
And maybe, if, for another silver lining, that it'll increase the access to care, right? Because we've always had the best health care, quote unquote, right? But it was always the access to care was our issue. And maybe, as these systems get in place for telemedicine and other things become more mainstream, that access to care will increase and more people will be able to access quality health care.
Yeah, especially people that live in south, let's say southeastern Ohio, or where there aren't as many doctors. It's hard to or specialists. Like you have to drive to Columbus to see that person, and you don't have a lot of money. You don't have a car. You don't. You're probably going to say not worth it, right? I don't have the means to get there. So it's that part of, let's say you need to see a liver doctor, and that's the closest liver doctor. You're just probably going to brush it off. But if you can see them through a video conference and get the care you need, I mean, that's life-changing and life-saving.
It is.
To that person. And so I don't foresee us saying, because for when all this has been going on, we've been saying, let's do a lot of telemedicine, right? The government's been saying, yeah, it's fine. Insurance companies have been saying, yeah, we're going to reimburse for this. I don't see how they take that back. Because I think we're going to find that when you look back on this time frame, people have better access, and I think it's going to be hard. I think doctors are going to say, hey, you know what? I was able to see these patients that I normally couldn't see, and that's a good thing.
Right.
Yeah.
As long as quality of care remains high.
Obviously, there's some things that you can't do telemedicine. Like obviously, you think you broke your arm, you need physical care.
Right.
But there are, plenty of things that you can do over the phone.
Yeah, and some of our services can just be further enhanced. By using technology in between visits.
Especially with chronic care management, people that have high blood pressure, people that things like that, or teletherapy. I mean, there's lots more. If someone that can only get to see you every 3 months for counseling can now see you more frequently because they have better access to you.
Right. And it seems like, just from watching, right, that we were already moving in this direction. I see the commercials on TV for, Roman. I'm not trying to advertise for any of these people, but, that they were already putting, or the 4 Hims, or the 4, you've seen these. And it seems like we were already moving in that direction. And maybe this is just going to be an accelerant.
So. Yeah, I think so. I've even seen that, some... ER doctors are using telemedicine to help triage patients before they come in, right? I mean, because that's helpful to our healthcare system in general, because then, going to a place like an ER is very expensive, and so if those resources can be, hey, you can, that's fine to go to your primary care doctor about, or I don't think, you need to go to the emergency room for that visit. That's helpful too, because we have a high healthcare expenditure, right? Yeah. And so if they can still get quality care and the care they need for a lower cost, that's obviously a good thing.
I agree, 1,000,000%. Just to touch on that again, I think a big area of medicine that will benefit from this is if you can keep them out of the emergency care by seeing them through the video, you've already saved healthcare money like you could not believe.
And a lot of people go to the ER not because they want to be in the ER, but because that's the access to healthcare that they have.
Exactly.
And so if you can get them other access to healthcare.
If you can pull your phone out,
Exactly.
Video, say, hey, Doc, what's going on?
What's going on?
Yeah.
I mean, that's obviously a big win.
Yeah.
Definitely. So how do you guys see, have you guys heard any funny patient stories? I know I've heard some working here. I've had a guy who's talking about cleaning himself in bleach, covering himself with trash bags, trying to get ready for, I guess that's how you prevent this virus. But have you guys heard anything? Have you seen patients actually go down an even worse psychological standpoint from this, the fear and the uncertainty, as you brought up?
I think I did in the beginning. I think I saw a lot of people that were almost getting, apocalyptic thoughts in their head, right? That this is going to be really bad. And I haven't seen it as much lately. I think now that we've kind of gotten more into this, people have realized that I can still go to the grocery store. I can still get the food I need. I can still go see my doctor. I can still, I think especially for our patients, there's a lot of fear around not having their medication. And like, I think once they've realized I still have access to my addiction doctor, I still have access to my medication, I think that has really calmed people
Puts them
down.
at ease.
Yeah.
It really does.
Yeah. I think, the changes to ability for people to get unemployment has helped too, because now I have access to my doctor, I have access to my counselor, I have access to my medication, and I have access to paying for my medication. And so, like, once you've kind of taken
basic
those,
needs.
yeah, then I think people can calm down a little more.
I think you're right about that.
And I think part of the kind of like that fear though, and I was talking to some other people about this the other day, is, because, everyone went out for some reason in the beginning and bought all this toilet paper and all this Lysol and all the Clorox wipes.
Right.
And so if people see everyone buying this, then I need to buy it too. Well, I think part of the problem is there's now a backlog and that stuff's not getting put back on the shelves. So it gets this constant fear of there's a shortage.
No, there's a psychology
Yeah,
to it.
like-
Yeah, no, you're absolutely right.
And so like every time you go to Target, I don't even need them, but I look every time I go, right?
I do too.
Because I'm like, if they're there, I should probably get some.
No, I actually have 4 things of wipes, which
Yeah.
I know I probably need one. But every time I've been to the store that they have had them,
Yeah,
I've just, I guess I better get one
Yeah,
because
better
it might
get
be the
one, right?
last one.
They're there, right?
Yeah, right.
Seeing bare shelves is very.
It's frightening, right? Because like
alarming.
we're a country of plenty, right? Like we're used to seeing shelves full and shelves full, and so not seeing that it's alarming.
Definitely, couldn't agree more.
What about with kids? Have you noticed either with your own family or clients how it's impacting them? Because this must be confusing to.
It is, yeah. My daughter's young; she's 4, and we've tried to tell her, like for instance, like her big thing is why can't I see my grandma and grandpa? Why can't I see my Mimi and Big? Like she's used to seeing. Like my parents live in Georgia, but they still see her once or twice a month. My husband's parents live 10 miles from us, so she's used to seeing them pretty routinely. And so we just had a frank conversation with her. She's 4, so she's not going to get a lot of it. But we said, there's a lot of people getting sick, and we're trying to make it so that less people get sick. And she's like, huh? And we said, well, a lot of people have germs. Oh, yeah, I don't like germs. And then so we said, well, we need to stay away from people so that we don't give them germs. And she got that.
Yeah.
But I think even if she understands it, she still is definitely frustrated. Because she'll walk by a playground. Why can't I play at the playground? Playgrounds are closed. I know they're closed, but why can't I play?
It's very confusing, and yeah. And I think that, we owe it, obviously different age groups,
Right.
you say different things, but kids are historically bad at making sense of complex things, like the classic example of the divorce, right, where the kid blames themselves. Well, if I had kept my room clean, maybe mom and dad. And I think we run the risk if we don't sort of fill in
Right.
the blanks of letting their minds.
Yeah, and we need to be honest with them, right?
think
This is something that, I think for a generation of people is going to be kind of defining. Like this is something that we all went through.
Hopefully we build resilience.
Yeah, exactly. Yeah,
out of
right.
it,
Absolutely. Yeah, there's lots of, I think, positive things that can come out of, obviously, like the presence of the virus isn't positive, but how we've altered our lives, there could be some positive things that come out of it.
Yeah, why
you
don't
know.
we each share a few?
Yeah.
Could you share a few?
Yeah, for instance, I feel so much more connected to my family than I have in a long time. As a physician, I work all the time, right? But paring down my hours, seeing patients from home through telemedicine has allowed me to connect more with my family. To the point that it used to be that my daughter was like, Daddy works all the time, to the point now where she cries when I go to work because she's used to me being around, and having that connection is nice.
Yeah.
Fantastic.
Yeah,
William?
I've noticed, I'm a caregiver for both of my parents who are older, and them being in a vulnerable group, I haven't been able to see them the way that I would like. And like you were saying earlier, just the increase in communication. I probably talk to them more now. So I think that is actually a positive thing. You know, even though, you know, they may need me in other ways, physically to help them with their medicine and other things. So I worry about that. But the increase in contact has actually been good and a therapeutic.
Yeah, exactly.
Yeah, and just to add on to that, I would say the access, just being able to go outside and have access to things. I mean, so many times we take that for granted, and then when it's not there, it's like, oh my God, I can't believe I could have done all these things, and now I'm very limited.
Right.
And I would definitely say it boils down what's really important in your life.
Right.
You know, what are the things that you really value, the things that you truly cherish, and the things that are just distractions.
Right.
Yeah, so I would say that's helped me focus on.
Yeah.
Focus on what you're grateful for.
Yeah, very much grateful for, and just hoping that, you know, this virus is so different in who it kills and who it affects that you never know. If you get it, you could be the healthiest person in the world, and it could knock you down
Right.
and take your life. So just being that much more grateful.
Yeah, because, you know, there's like, well, you always hear people talk that like, is the fragility of life that makes you like care about it, right? Yeah, it's like, you know, and so like adding that extra layer kind of, I think, gives you more like care for your everyday, and that you're healthy, that your friends are healthy, that your family's healthy. Yeah.
100%.
So, go ahead. No, well, anyway, I think we might be saying the same thing anyway, but we've seen an uptick, right, of patients at our clinic, new patients coming in. Why do you guys think that's happening? I got some suspicion, some ideas, but why do you guys think that we're having more new patients than normal right now?
I think part of I think isolation can bring out a lot, right, in someone, and I think maybe perhaps you have a lot of people who say, all right, you know, I normally don't have time to focus on my recovery, you know, that I've been so focused on, you know, that I've trying to find drugs or trying to get money to pay to get my drugs, and now that, you know, I can't go out and do things, or I can't work, this is a time for me to focus on myself.
So people are more introspective,
yeah.
questioning their decisions and their path and things like that. Yeah, I think that has something to do with it for sure.
And I think we've also shown that, you know, I'm not saying this to alarm patients who are in addiction treatment, but there has been, you know, some research that has shown people that have a history of drug use are at higher risk for serious complications of the virus.
For sure.
And so I think people might be like, all right, I need to mitigate my risk. I need to lower my risk, right? And so I think that could be.
I hope that's what's happening.
Yeah. I have a little bit more of an optimistic view than. I mean, I think both are. You know, I think there's obviously, you know, lack of access too that is causing some of it, but.
Yeah. I'll share. I think another reason that might be driving this is because I think a lot of people who are using drugs, they say, you know, okay, I'm going to use today, but tomorrow. And with something like this, which is pressing more and more pressure every day, you don't have that tomorrow. Tomorrow's a question. Tomorrow's maybe not.
Right.
And because of that, this true crisis, the things that drive, you know, people to use drugs are obviously a trauma, usually. And this has completely foreshadowed that. This has overcome that trauma and said, hey, I need to get myself in line, because now I have this unknown variable that is completely changing the game.
Yeah, and it's an equalizer in a way too.
Yeah, definitely.
Well, you know, and part of the problem too is that I think a lot of people have a viewpoint of, you know, every person that's addicted to opiates, you know, got there because they just one day decided to use heroin, right? And I think that's but what a lot of people forget too is a lot of people who are addicted to opiates became addicted because they were prescribed them initially. 100%. They had surgery, they broke a bone, they got in a car accident, and so they were prescribed these opiates for long periods of time. And I think part of what we might be seeing is that, you know, you have these patients who have been on opiates for a while. Now all of a sudden their doctor, let's say they were getting them from their primary care doctor, and their primary care doctor decided, I'm not going to see patients at all during this, and I'm not comfortable writing this opiate prescription over the phone, so I'm just not going to prescribe it.
So their access.
So now you have these people that were prescribed these opiates who didn't realize they were addicted, right? They just were taking their medication as they were prescribed, and now oh wow, I feel lousy now that I don't have access. Now that these prescriptions that my opiate prescription has been stopped, and I think you're having some of those patients too be like, wow, I didn't realize this was a problem.
Yeah.
Sure.
When I think withdrawal, you're talking about it from a legal standpoint. I think from the illicit drug market, I think there's probably, my suspicion is that there's shortages happening right now. Just because the normal, pathways of travel and communication and are just shut down to a minimum. And the illicit drugs travel on top of legal, trade routes. And so I have a suspicion that there's a problem with demand, with supply right now.
I'm sure, yeah.
Do you think that's probably?
I couldn't agree more.
And I think that when that dries up, then prices go up. And when prices go up, people can't get drugs, people hoard drugs. And we run into those sort of situations.
But the silver lining, right, is it's bringing them into treatment, right?
Yeah.
And so if that's what brings them, to getting onto the road to recovery, then that's fine. They're changing their lives, and that's obviously good.
Very good.
Yeah.
It's very interesting too. I'm downstairs and I've got a like a whole shield that's keeping me different from the patient. And just to think, 2 months ago that wasn't a thing.
Yeah, I wonder how long that's because I don't remember where I was. Oh, I was at Kroger the other getting groceries, and they have that plexiglass installed at the cash registers. You wonder will that stuff go away, or is that just
right?
How it? Yeah, like that. Is that just
the new way?
because what people forget too is we'll get a vaccine and get this taken care of, but we'll still have low levels of it, and are those just hey, you know what? It's already here. Let's just keep it. It lowers the risk, right?
So do you think that's almost like a societal PTSD in a way?
I don't know. I think PTSD is a legit problem that some people may have out of this.
Sure.
Especially, I'm concerned about. So talking about isolation. If you really want to talk about isolation, talk about those patients who have COVID-19, right? I mean, those patients are in the ICU or in their hospital entirely alone.
Yeah.
And so I think you might have patients that get some PTSD because of that. At this low point when they were the sickest they've been sick.
People that have been quarantined. Yeah. And there's no way to sugarcoat it. It's we need to stay away from you.
And then
that's got to have an impact.
Right. Yeah, absolutely.
Just has to.
Yeah.
Yeah.
I mean, I think you brought up earlier when we were talking about the antibody test. I think which is a great test because it'll help us know how widespread it has been. That you have antibodies for it, so that means you've had the virus. Now we're not 100% confident yet that because you have the antibodies that it means you're immune. We don't really know the answer to that, but or how long you're immune if you have the antibodies. But I think you brought up earlier, is there a concern that you don't have the antibodies, you need to be go
Right, are we gonna shun?
Yeah, I don't think that'll happen, but I understand the concern. Yeah.
No, I think these are valid concerns, and we were talking about when there's the unknown, and as we start to fill in these blanks more and more, hopefully these concerns will minimize as we move along.
Yeah.
But I worry too about casual touch. We need that in our life, and you don't realize how much that happens. A pat on the back, or a hugging your mom, or doing these things, and we need that in deep ways. We need touch, and so I worry about as a society that we're going to start limiting that, all that appropriate, physical contact we have with each other.
I think it'll be slow to get back, especially before the vaccine is around. But I think we'll get back.
We have to.
Yeah, I mean, we have to.
It's part of who we are.
Yeah, I really worry, from a friend standpoint, checking in on people that, I have a family, so when I'm if I'm stuck at home, or safe at home, I have people to interact with, right? I really worry about my friends, and we've been pretty good about checking in with them that are, someone who is single and has a non-essential job, right? So they're home and not working. And because a lot of people are still working, but working from home, and they're having Google meetings and video meetings, and are still like interacting with people. But I worry about the people that are home and by themselves and not working. So I think it's really important just to connect with them. And
No, there's a lot of people out there that their connection comes from the random people throughout their day.
Yeah, exactly.
The barista where they get their coffee, and the person on the train, and that is their routine of social interaction. And you're right. Those folks who live alone, we really do need to be checking in on our friends who live alone.
What we've been doing too is like sometimes you'll go on a walk and you'll walk by your neighbor, like your friend's house. They can come out on the patio and like you'd be on the road and still talk to them. Like you can still see them and still like it. I mean, there's still ways to interact with people.
Yeah. No, I've done lots of stop and chats, more stop and chats than normal.
Yeah.
I also saw this thing, and I don't know if this will catch on or not, but where neighbors are putting Easter bunnies, these little rabbits, stuffed rabbits, in the windows, and then as you walk with your family around the neighborhood, you look for them like an Easter egg
That's
hunt.
awesome.
And it's just it's something the community's doing. I think it's pretty cool.
One thing I saw that somebody, like, I don't know if it was just some Facebook post or somebody that I actually know, I can't remember, but it was where like this woman has an elderly neighbor who's really high risk, like in their 80s and has a history of cancer. So that's not someone that you really want to have out and about. And so she has 3 cards. She has a green card, meaning everything's good, she feels good. And then she puts that in the window for the day. And then there's a yellow card meaning I need help with something. All right, I need help. And then if she has the red card out, it means she needs immediate attention.
Oh wow.
And I'm like, oh, that's a kind of a like
Smart.
yeah, like because you have older patients, patients in their 70s, 80s, 90s who aren't as comfortable with technology perhaps, and so it's a good way for to get their point across without having to get on Google Meets, right?
Yeah.
100%.
And I wonder if we'll start thinking through some of these things and maybe formalize some systems going forward. God forbid this sort of thing happens again. At least we'll be prepared in some of these ways to know what our needs were, and we can hopefully improve on that.
Yeah, it's really funny how a lot of people say technology, smartphones, they took away from the socialization and the personalization that goes into all the social dynamics, and then something like this hits, and without technology, we would truly have zero socialization.
No,
So
you're
it's
100% right. And a lot of times with crises, right, be it war or, after 9/11 or Hurricane Katrina, that people come together, and to solve the problem. And in this one, the problem hits, but we all have to go to our separate corners, which makes this much different. But you're right, it's only because of the technology that we've been able to maintain our tradition of coming together in crisis. You're absolutely right about that. That's a really good point.
So it's very interesting. Suicide rates. Why don't we talk about that a little bit? So suicide, depression rates, they've said they've gone up, and I definitely see why. Isolation, basic needs of socialization. What are some other things you guys think are driving this up? Unemployment, obviously.
Yeah, I mean, like people's stressors are just through the roof right now, right? I mean, and not only, let's use that example, right? Person has a non-essential job and they live alone. And so they are by themselves, so they're isolated, and they don't have income. And so if that person also suffers from depression or other issues, I mean, the feeling of hopelessness is pretty easy to conceive, right? Like how they get down to that path, and then having lack of access to someone to help them.
Yeah, definitely.
So that's why I think checking in on those people is important, whether they have a history of psychiatric issues or not. I mean, it's still important to check in with them.
And you mentioned the financial. That's a big stressor.
Of course.
Financial strain can burden even the most sound relationships.
Couldn't agree more. Yeah.
You know what I mean? And so if this is exacerbating that, I worry, and I think that could lead. And obviously, depression is correlated with isolation and despair, and we have that in spades right now, unfortunately.
Yeah, definitely.
I do get the general sense, though, that I do feel like the level of despair has lessened, because I feel like people do feel like what we've done is helpful. So I think that's getting slightly better, but it's obviously still there. And one thing I saw too is that like the way you know we did enough is if it seemed like we did too much.
Right.
Sure.
No, there was a while there that I
yeah.
couldn't tell is under preparing or over.
yeah.
It looked the same.
Yeah.
You know,
Yeah.
and
Because it takes weeks to see what we've done. Like, you know, because the people that we're seeing infected now were infected 2 weeks ago, right? And so like it takes a little while to get up to it. And I think seeing positive change is helpful to those people, right? Like, okay, like I'm isolated and it felt like I was isolated and it was still going to be awful, right?
Sure.
But now I'm isolated, but it looks like things are going to turn around in the way we wanted them to. I think that's helpful.
that is that you can start to imagine a future
Right.
of normalcy.
Right.
Yeah, where maybe 2-3 weeks ago that was
You're like, I don't know when that's going to be.
Right.
Yeah, is that, am I going to have Christmas? Like, you know, is it going to be? But now I think people are saying, all right, I see this happening. And
So even bad news that is known is better than unknown.
Yeah, no, absolutely, yeah.
You'd
Great
much
point.
rather have bad news and
Yeah.
know it than to just be in the dark.
that's why I was talking to, like, my family and I about, like, we all know that stay-at-home order is going to get extended, you know, through the end of the month. We're like, because we were talking about this like a couple weeks ago, like we're like, they just need to do it now because the unknown is not helpful. Like, it's good. Like, if I know I have to do this for a month and a half,
Right.
that's much easier than being like, the day before it's supposed to go away. Oh, now another month.
Right. It's like 24th day of the 15 days to slow the spread. Yeah.
It's good to like know what's coming.
I agree.
So if you two could recommend some things we could do to fight the depression, the suicide, you know, risk factors, what would you guys recommend?
I think, you know, you need to, what I've been trying to do is, you know, interact with at least 3 of my friends on a day. Like, you need to interact with people. And like I said, you know, earlier, I know I said this already, but if you are concerned about them, that means you need to contact them, right? Because you're concerned about them for a reason. But and also I think it's something that's important is we're talking about suicide rates and depression. I think you really need to check in on your people that are in healthcare, your friends that are in healthcare.
Yeah.
Especially people that are in the ER, people that are working in the ICUs. I mean, they're seeing some pretty horrible stuff, right? And then, and they're putting their lives at risk, right? You know, and so checking in on them is important because I'm afraid we're going to see a high level of depression, suicide attempts, and burnout from people in healthcare.
I couldn't agree more. William?
Yeah. You know, one thing I've been telling my clients, so I'll mention it here, is to maintain a regular schedule throughout all this.
Absolutely.
Get up, take a shower, get dressed, you know, have regular meals, and continue to do what you normally do.
Sure.
You know, have things that you're looking forward to, have tasks that you're going to complete, because with the absence of that structure and that schedule, you know, that's where depression can really, you know, take hold. You know, if you look at somebody who is dealing with depression, it's the opposite of what I just mentioned.
Sure.
You know, so what we want to try to do is purposefully create and maintain normalcy
Yeah, I like that.
best you can.
Fantastic.
No, I like that a lot.
Yeah.
Fantastic. Yeah. I would just add, you know, if you can, make sure you're exercising,
Yeah,
trying to get
that's huge. That's
exercise,
huge.
you know, daily because it's easy you're cooped up all day. Gyms are closed.
know.
Right.
Get creative though.
I always laughed. I said, I'm either going to come out of this thing 20 pounds heavier or 10 pounds lighter. Those are the
Well, I think a lot of people are going to focus. I just feel it. They're going to. It was underlying conditions that put people at most risk.
Yeah.
And I really think that going forward, we're talking about silver linings. That people are going to try to eliminate these. I hope.
Yeah.
People are going to try to get in better shape. They're going to deal with
Yeah.
high blood pressure. They're going to try to treat their diabetes.
Yeah.
And I hope that is a result of what's happened here. But I guess only time will tell.
Yeah.
Yeah, I just want to bring up one thing. Dr. Dee Dee Hirsch, who is the medical director at Hirsch Mental Health Services, he talks about how it's very important to, if you have anxiety, fear during this time, to write them down. Because when you write down your feelings, you take an unknown thing that might be running around in your unconscious and you put it on paper.
Right.
And when you do that, your brain's better able to make a battle against it. What do you guys think about that?
Oh, you're right. Yeah.
And I also
You're
like,
right. Whoever's right.
and I also like the idea of talking to someone about it, right? Because like sometimes you get so anxious about like I know it shouldn't be having this anxiety, which makes you feel worse about it, right? But if you can connect with someone, be like, no, I'm nervous about that too, or I'm anxious about that too. It makes your feelings seem legitimate, because I mean any feeling you have is legitimate, right? But it makes like other people have this feeling, and I think that makes it easier to handle. Like other people are feeling this way too.
Yeah, and that's one of the benefits of group counseling,
Yeah,
right?
right.
Is that it normalizes people's experiences. Yeah.
Sure. Fantastic. So if you guys could say 3 ways that this is going to change medicine, because I definitely think it's going to change medicine, all these fields, what do you guys think they'd be? Good, bad, in the middle?
I think good was access. I think we've proven that access to medicine is important, and that we can access medicine differently than we're used to accessing it. Negatively, I'm worried about the fallout of healthcare workers. We haven't seen it as much in Ohio because Ohio, we had a very aggressive mitigation strategy, like where we did social distancing early, we closed schools early. So we're not seeing these doctors and nurses having to make decisions about who gets treatment and who doesn't. But there are some areas, where there's just this massive onslaught of patients that, these doctors and nurses are working in a war zone, right? And I think that can be really, really detrimental to our healthcare system. There's already a shortage of nurses. I mean, and so if you're going to make that, worse by people leaving, and for some people rightfully so, if you have these healthcare administrators telling you still need to work without your PPE, these like people aren't going to forget that, right? You don't forget that like you didn't care about my health, and so I'm nervous about that as like from a bad standpoint. And then I think like another good is it helps us realize that everyone needs healthcare, right? And that we need to look at how we provide that to people.
I agree with that. I'm hoping that that it creates resiliency. We were talking about that earlier, and so I hope that that's one of the big takeaways. That people walk away knowing that they're capable of overcoming the obstacles and challenges in their life. And then what I just mentioned a second ago, which is I hope everyone starts getting more healthy. And I really do think that that's going to be a positive outcome.
Fantastic. And yeah, I'll just add, I think it's so interesting when the environment's clean and safe. We've got these political wars. We've got all of these different wars we have with other countries competing for resources, for who's the number one big dog in the world. And then something like this hits and it shatters that. And it says, hey, we're kind of all on this planet together, and that it's important to remember that.
Yeah. No, I hope that's what happens, right? Because it can go one of two ways. We could all just go to our own corners, or we could come together as one. And I hope that we choose correctly.
100%. And another big fear I have is, I'm currently in nursing school, and it's all of my training is online now. So all of that patient interaction, 2 8-hour shifts with patients is gone now. So I'm doing a virtual assessment, virtual procedures, all of these, learning all these different therapies, and it's nowhere near the same. So I worry that as we burned out, as you were saying, we'll have a huge burnout while people in school are even questioning. I know a lot of my classmates are thinking, is this even worth it?
That's what I was just saying, or is it, is it even worth becoming a doctor or a nurse? Because and it is.
Right.
But I think it's a legit fear.
But then, so the burnout with these people coming in saying, hey, for 3 years I had online experience. Is it going to be
as good?
Right? Are you going to have prepared people?
And this is really like the first time in, I think, anyone that's alive felt like being a nurse or a doctor puts your life at risk. And that really makes you wonder. But it's,
how passionate are you?
Yeah, it's a very rewarding. I think we all are very passionate about what we do, but I think it will make people stop and think.
That's great. So I like that. Maybe it'll get an even select few people that really, really want it. It'll dial that out.
Well, I think you might end up being surprised. Right after 9/11, remember all those people who went and signed up.
Yeah.
You know what I mean? They said, no, I'm going to do something about this. Yeah. I'm going to go fight whatever they were doing.
Sure.
So I wouldn't be surprised if we see an uptick in people wanting to be first responders and nurses and maybe pursue medicine just because they have that opportunity to be in service and to help.
Sure. That pressure makes diamond philosophy.
I hope, again, that's what happens.
Me too. Well, we really want to thank you for
that was
joining
great.
us.
Yeah,
Yeah,
thank you.
yeah,
Happy to be here.
of course,
Yeah.
and hope you come back.
Yeah, I'd love to.
Awesome,
Fantastic.
man.
All right, thanks,
Thank
guys.
you.
Thank
Yep.
you.